At this point, most everyone is aware that epidemiologists have been playing a major role in understanding and fighting the COVID pandemic. But what exactly is an epidemiologist? Epidemiology is one part of public health. Epidemiology is also referred to as the basic science of clinical medicine. Research in clinical medicine tends to focus on individual patients and how to treat them. Epidemiologists, on the other hand, study health and disease in populations. When they study a disease, they look at large groups of people to understand what the risk factors are for the disease, how to prevent it, and how to improve outcomes. They're frequently concerned with who, where, and when of a disease. That is, who is getting the disease or seems to be protected. Older, young people, smokers compared to non smokers, those getting regular physical activity compared to those who are sedentary. Another focus is where are the people located who are getting the disease? For COVID 19, there's been a lot of focus on hotspots, the cities, states, or even zip codes with high rates of disease. When is another factor of interest. How long is the time between being exposed and when symptoms show? Are there seasonal differences in rates of disease? We see seasonality for for example. By collecting information of this kind, we can understand how best to structure prevention and also identify the populations that need more health care. It's worth noting that epidemiologists don't just study infectious diseases like COVID 19, they also study chronic diseases like heart disease, eye disease, cancer. My own research is on breast cancer. We did a study where we found that women with periodontal disease were at increased risk of breast cancer. We're now trying to take those findings further to understand if the microbiome affects breast cancer risk. Epidemiologists also study what happens when populations are exposed to factors or behaviors, such as smoking, electronic cigarettes, alcohol consumption, diet, physical activity, personal characteristics like age or height. So, the next time you hear about what an epidemiologist has said about COVID 19 and how best to prevent it, you'll know a little bit more about what an epidemiologist is.